Hello and welcome to Inside Indiana Business. I'm Gary Dick. Indiana has the 15th highest death rate from drug overdoses in the United States. And that is one reason why Governor Eric Holcomb, one of his first orders of business was to create a new cabinet position, Executive Director for Drug Prevention, Treatment, and Enforcement. And the state's new drug czar is a familiar face in the Indiana business community. Former longtime Goodwill Industries of Central Indiana CEO Jim McClelland. He's come out of retirement to take on this big challenge. And he joins us now in studio. And always, Jim, welcome to the program.
Thank you, Gary.
Well, retirement didn't last very long.
I totally flunked it, Gary.
40 plus years as CEO at Goodwill. Right. Obviously, it would take something very important for you to come out of retirement. Talk about this drug epidemic and really the crisis the state is facing.
When Governor Holcomb asked me to take this position and described what he wanted to do, I couldn't say no. It's an opportunity to get back and work with a team of really top caliber people to try to figure out ways to substantially reduce what has become just an enormous problem that cuts across all socioeconomic lines. It's affecting all parts of the state. Of course, it's a national problem as well, and there is so much to do. And we're going to move as fast as we can to try to have some significant impact, and there's a lot to do.
I mentioned Indiana 15th in drug overdoses, which is a terrible statistic. A lot of other stats, too. And as you mentioned, it's not just Scott County got a lot of attention last year for the HIV outbreak. But this is a statewide issue. Human toll, no doubt about it, but also a major economic and business impact.
It really is. It's affecting of course, it affects not only the drug users, it affects their families, their friends, it affects employers. Companies tell us that they can't fill all their vacancies because so many people are flunking the drug tests. There are people abusing prescription opioids in the workplace. And it's just an enormous problem. Plus the fiscal impact of dealing with the crisis is huge as well.
Okay, let's talk about tactics and what some of your priorities here. I know there'll be short and long-term goals here, but as you right out of the gate, what are some of the things? We
want to make sure there's a drug, naloxone, which if a person overdoses and naloxone is administered to them, it's an inexpensive drug. It'll bring them back, keep them alive. We want to make sure there's plenty of that out there. We want to do what we can to stop the death rate from continuing to go up. There are more people dying of drug overdoses now than traffic accidents or homicides. So we need to do that. We've got to greatly increase access to evidence-based treatment around the state. There's not nearly enough. This is also a national problem. The Surgeon General recently reported that only 1/10 of all the people who are addicted are getting treatment of any kind, and of those, only 1/3 are getting evidence-based treatment. So there's much, much more to be done there. And then finally, we want to reduce exposure to opioids. Some of that's going to come through prevention programs, education and prevention programs, and some of it's going to come through trying to disrupt the supply chain.
Enforcement, obviously a big thing. Governor Holcomb is supportive of the needle exchange program?
Yes, understanding that it's what's called a harm reduction program, so that people who are using are not going to get other they're not going to be infected by HIV, hepatitis C, which has been an enormous problem with people who are using dirty needles. But that will save money as well. But it's got to be part of a larger strategy to deal with the overall problem.
Only have 30 seconds, Jim, but you're going to be overseeing 9 agencies, direct report to the governor. How about, there's been a lot of criticism about lack of communication between those agencies. How important is it to break down those silos?
Well, and I will tell you, that's what we have to do. We have to do a better job of coordinating, aligning, and focusing the resources across these agencies. But the people that I've been working with, I've been talking with the various state agency heads, and everybody wants to work together to attack this problem.
All right, Jim McClelland, the state's new drug czar. Great to have you back in the fray, so to speak, tackling a big challenge. Thanks for being here, Jim.
Thank you, Gary.
Okay. Well, our conversation on the opioid crisis in Indiana continues now. Inside Indiana business reporter Mary Rachel REDMAN is here now with more.
Thanks, Gary. He's been called Indiana's leading political voice on cracking down on heroin addiction. In fact, Senator Jim MERRITT submitted 19 pieces of legislation asking for a comprehensive study to evaluate the economic impact of drug addiction on the state of Indiana. The study would focus on governmental agencies and programs, to insurance companies and other private businesses, to individuals. At the moment, he says Indiana does not possess enough psychiatrists, hospitals, healthcare clinics, or a robust enough detox recovery network to deal with the problem that impacts some 300,000 Hoosiers.
Many people want to come forward, but a lot of times they have to go to Michigan, they have to go to Arizona, they have to go to California or Florida to get treatments. They say sometimes that in Indiana, you have to go actually into the Department of Corrections to get clean because we don't have the services here.
Affordable detox treatment centers would potentially cost the state $4 to $10 million. Senator MERRITT also added he believes if we tackle the complex issue immediately, we can kill the heroin scourge in the state within 5 years. Gary?